Uncontrolled drugs. We have an inventory record, and when we count our medications, our controlled substances, we want to make sure we have the right amount, and we make sure the cart is double lock. So we have one lock here, and we open that, and then we have a second lock, and we need to open that one. And we have our controlled substances. In here, you'll see that there is a letter C on it that shows it is a controlled drug. It is different than the other medications. The regular medications don't have to be under double lock, but controlled drugs do have to be under a double lock. And you will count with each QMAP at the end of your shift to make sure the medication is correct. Okay? Next, we'll talk about MRBs, and we'll flip to that page. Our medication reminder box are MRBs. We're going to have a medication sheet for those, and there are different type of MRBs. This one could be given once a day. This one could be given twice a day. This one also is once a day. But the MRB we're going to use today can be given up to 3 to 4 times a day. And we want to make sure always the MRBs are clean before we fill them. We want to make sure that we have a label on the back and it matches everything. We're going to take our medication supplies out that we need. And we're going to make sure that everything matches. So we're going to read the first one. It's Coumadin 3 milligrams, and we're going to make sure it says Coumadin 3 milligrams here, and also on the bottle that it says Coumadin 3 milligrams. So we want to check it 3 times, 1, 2, and 3, before we fill the MRB. Okay? As in your study material, it says you can use the MRB up to 14 days, and one thing is this particular patient has a order for Tylenol. PRN for pain. You cannot put PRN medications in an MRB. That would have to be given to her separately, but all routine meds can be given as an MRB. Okay? So we're going to put that up, and then we're going to start our medication pass. We are going to start with a regular medication first. And of course, we wash our hands before we start, and we put on gloves to give medications. Our first medication is a pill. And generally, you're going to check the order 3 times to make sure it matches. And you're going to get your supplies ready, and you're just going to put your pill over the cup and pop it out. Okay? And then you're going to get water. And you're going to give that to your patient, making sure you identify her. Hi, my name is Carolyn. I'm your QMAP today. I'm going to give you your medication. Could you please state your name? And she tells you her name. And you're going to give her medication with some water. Make sure she is sitting up to take medication so she don't choke. If you need to, you can give this medication by crushing it, as long as you get a doctor's order. Even if you want to break it in half or open a capsule, you need to get a doctor's order for that, okay? Make sure you stay with your patient as they swallow the pills to make sure they don't choke, or the pills don't fall in the bed, or they just don't take them, okay? Now we're going to go back over to the cart, and we're going to look at what other medication this patient needs.